This video is about the legal and illegal methods or substances used to enhance performance by athletes. There's no kids up tonight, so you won't get any cameo appearances from them, hopefully. So if you look at chapter 15, this diagram helps to show us what are the legal or ethical methods as well as the illegal or the unethical methods to enhance performance. So these are the ones that we're going to look at tonight. Over here for the legal methods, we've already looked at dietary and physiological strategies and training strategies to improve performance. But we're going to look at a couple of other legal methods to enhance performance. The next video or the next chapter in your book will talk about the role and the rationale of the governing bodies that govern these prohibited substances and methods. So, VCAR key knowledge and skills. Here's the key knowledge. It details that in terms of performance enhancing either methods or substances, these are the ones that we're going to look at. Obviously green is okay, is good, legal, and the red stuff is the banned either methods or substances. So firstly, I think it's relevant to think about what constitutes an illegal substance or an illegal method. WADA, their ruling on that is that a substance or a method must have two of the following criteria. It must meet two of the following criteria. So the three criteria is pretty much that it will enhance performance, and there's evidence to prove that it enhances performance. Or number two, it is a health risk, so it can endanger the health of the athlete. And thirdly, it violates or goes against the spirit of the sport. So, for example, in the past, caffeine has been banned, and although caffeine doesn't pose a health risk, a significant health risk, it does enhance performance, and at the time they argued that it violated the spirit of the sport. Most of the banned substances or methods violate the first two. Yes, it improves performance, and secondly, it poses a health risk. So for WADA to make the substance or the method prohibited, it must meet two of those three criteria. And of course, substances that mask or try and disguise a particular substance, e.g. a steroid, those substances are also deemed prohibited. In this video, we will reveal the potential harms to athletes that take prohibited substances or methods. So it's an obvious question to ask, well, why do athletes take prohibited substances? And here are just some examples of why they do. As you can see, it can be their competitiveness and their strong will to reach the very top levels of their sport, and many of them perceive that it's okay to do it if other people are doing it. If their peers are doing it, they sometimes believe that there is no health risk to them. So there's a number of different reasons why athletes will use prohibited substances or methods. This slide has been taken from the WADA prohibited list a few years ago, and as you can see there's many substances that fall under different classifications. So we'll go into more detail about some of these. These next two slides show us what the substance or the method is, what the perceived benefits are, so what would be the reason why an athlete would take them, and also highlights what are the risks associated with taking these? What are the potential harms to the athlete? We're going to go through each one of these individually, but this is a great summary table that you could use for your notes. If you look closely at many of the harms, you'll see that often a potential harm is to do with heart failure or death. Heart failure, death, heart failure. This one, not as much. So to help you understand what the harms are, if you understand what the actual drug or substance does physiologically to the body, then that can help you remember the potential harms. So there are a number of hormones that are illegal. The study design states that you need to know steroids, growth hormone, and EPO. So we're going to go through those three. So growth hormone is the illegal growth hormone, is a synthetic hormone which promotes muscle and bone development. And what the anabolic steroids do is they are a synthetic version of the male hormone testosterone. I'm sorry, I was talking before about the growth hormone. So now I'm talking about about anaerobics. Anabolic steroids. So yeah, anabolic steroids are traditionally used by athletes that want muscle hypertrophy. They want big muscles. Look at the dude in on the PowerPoint. They want increased muscle growth, which increases muscle force, which helps to produce greater power and strength. So as you know, males have a naturally occurring hormone, testosterone, that is responsible for these changes in our body and these actions in our body. When this hormone is replicated synthetically, it is illegal and it does the same jobs. The advantages with taking these steroids is that it helps athletes to complete a higher quality workout, because one of the effects of the anabolic steroids is increased aggression, and that helps them to push through pain and gain a greater quality of workout, which will ultimately lead to greater adaptations. But also anabolic steroids increase protein synthesis, which are the building blocks of muscles. Finally, anaerobic steroids are the most commonly used sporting drugs, because if you look at most sports do require athletes to produce either strength or power or speed. Okay, so moving on to growth hormone. The growth hormone, again, this is a naturally occurring hormone in your body, but when it's replicated synthetically, it performs the same job, which strengthens bones as well as muscles. So growth hormone is not just used for athletes heavily involved in anaerobic sports, but the growth hormone is also used for aerobic endurance athletes. And the other advantage with these types of hormones is that it also acts as an anti-inflammatory, so it helps to reduce swelling and reduce pain, and they can often help athletes perform when they otherwise wouldn't be able to. Risks include heart failure, but it can impair the immune function, and you can retain water, impotence, and the heart failure, that's a big one. We don't want that. Okay, EPO. This has raised a lot of media attention in recent years. EPO is again, a naturally occurring hormone. It's produced in the kidneys. It stimulates messages to both both to the bone and by the liver to produce more red blood cells. And what do red blood cells? They carry more oxygen. The athlete can work at higher intensities for longer durations aerobically. So when this is produced synthetically, the problem with that is that if you have a greater number of red blood cells in your body, your blood is thicker, it's more viscose, it has greater viscosity, which can lead to blood clotting, heart failure, and death. And it's important, if you understand what the hormone does, it's similar to blood doping. We'll explain blood doping a little bit later. But when you increase the number of red blood cells, that's going to increase the thickness of your blood. It's going to be more stressful for your heart, and you've got more chance of your arteries getting blocked and suffering heart failure. I'm sorry, before I forgot to mention the risks associated with the anabolic steroids. Depression is a big one, cancer, high blood pressure, which is called hypertension. Females can take on male sex characteristics such as beard and deep voice, and for both genders it can lead. Okay, beta blockers. These are the drugs that are used to slow the heart beat. Boom, 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 boom. If you can control your heart rate, your body experiences fewer vibrations. So for sports where accuracy such as shooting and archery are very important, having a low heart rate is really important to minimize the vibrations through your heart beating. It also helps to decrease nervousness and helps athletes to be more calm. But of course, anything to do with slowing the heart rate down, one of the risks is that you can experience cardiac failure. Okay, these bad boys. Why do people take diuretics? Why do they want to lose fluid? Well, they want to do that where weight is important, such as jockeys or fighters. They may take a diuretic so that their body releases water. And as we know, water weighs a lot. If you lose half a litre of water, that's going to save you half a kilo of body weight. And the risks associated with that is, of course, if you lose water, you'll be dehydrated. You can suffer from cramps and, again, irregular heartbeat. As well as diuretics, you have what's called masking agents. What masking agents can do, they disguise other substances in your blood or urine. And one of the ways that they can do that is a plasma volume expander. So if you imagine that the plasma part of your blood is bigger, is more, that can, say, disguise the fact that you've taken EPO, which has increased your red blood cells. So stimulants make us alert. They help us to react very quickly, and these can be used in a number of different sports. Substances that are classified as stimulants are things like caffeine, which is legal, but substances that are illegal are things like amphetamines, cocaine, and the health risks associated with these. We'll think if you're more alert, you can be more anxious, you can be paranoid, you can not sleep, and of course very severe risks involve stroke, because we're messing with the brain, or heart attack. So narcotics, although narcotics are not listed on the study design, I wanted to just touch on it because narcotics are often used to mask pain so that athletes can continue working when they otherwise wouldn't, but they are highly addictive, and any drug that's highly addictive has severe health risks associated with it. Dependence, addiction, and that can lead to respiratory failure if you take too many drugs that make you feel euphoric and mess with your central nervous system, which blocks pain. Your breathing can be reduced to a point where you stop breathing. Okay, so blood doping, this is a method. This is not a pill or an injection. This is a method. What blood doping is, a medical practitioner will withdraw blood from the athlete, and this blood will be stored and later put back into the athlete. But what happens is when your body is low in blood, whether you're bleeding or whether you have blood taken out, what happens is your body registered, your kidneys go, oh, I don't have enough red blood cells. Hurry up. Can you make some more bone? Make more bone marrow to produce more red blood cells. And so your body makes more red blood cells, and this may take a couple of months. However, once you've restored back to your normal red blood cell level, then that blood is put back, that you took out a couple of months prior, is put back in your body, which increases the number of red blood cells. More red blood cells, more hemoglobin, more oxygen carrying capacity. Aerobic athletes can work aerobically higher intensities for longer durations. The problem with this is that, again, same as the EPO, it makes the blood thick, it can cause heart failure, and not good. Okay, so gene doping is a little bit different, similar to blood doping, except instead of playing around with blood, it's playing around with genes that have specific jobs in the body. So with gene doping, it's where you are changing or manipulating cells in your body or genes in your body. And it's not just adding of, it could also be the removal of. For example, there's this gene, myostatin, and that prevents muscle bulk. So if doctors can take that out of your body, that allows for greater muscle hypertrophy, greater muscle bulk, which means more strength, power, and speed. Conversely, it also includes adding genes, such as EPO. If you can add the gene responsible for producing red blood cells, you have a greater oxygen carrying capacity. Okay, so now moving on to the legal side of things. As you can see on the slide, we've covered all these previously. So what we're going to look at tonight is just the enhancement of oxygen transfer and altitude training. Both of them have similar effects, but we'll talk about them individually. These are both legal, which means that they're ethical, they're okay, and the reason why athletes want to use these methods is that because it helps to increase the number of red blood cells in the body. And as you can see here, 97% of our oxygen that's used by the body is transported through hemoglobin, our red blood, which is a protein attached to our red blood cells. So that's what we want to increase. How do we do it? Altitude training is one. When athletes train above 2,000 meters above sea level, the body has fewer oxygen available. So they experience oxygen debt, and the body has to learn to cope with this by trying to take in more oxygen as well as utilizing the fewer amounts of oxygen it has far more efficiently. Now, the thing with altitude training is it takes a minimum of 3 months to acclimatise. Initially, in that first 3 months, because there is lower pressure up high, there's lower pressure, there's lower amounts of oxygen, athletes can experience headaches, higher heart rates, and that they don't, their VO2 max decreases. So this actually can result in a poor performance. However, if they stay up there for longer than 3 months, the benefit that they get are similar to those that are gained through aerobic endurance chronic adaptations training. Down the bottom here, it results in increased red blood cells, increased hemoglobin, increased capillarization. All these adaptations deliver more oxygen to the muscles. However, here's the tricky part. However, the problem with altitude training is that because there is not much oxygen up high, athletes can't do very long continuous sessions because it's too difficult, so they can't get the quality sessions up high. So what did scientists develop? Well, they developed what's called an hypoxic tent, and this is where they train in an environment where there is low oxygen, right? In a hypoxic tent, it's where you do not have as much oxygen. Why? So that you get the same benefits of training up high. And as we said, these are all the reasons why we do that. But as I stated before, the problem with having long sessions in an environment where there's not much oxygen, athletes can't do quality workouts. So scientists then developed what's called live high, train low. So, just trying to get a marker. If you live high, so here's an athlete living in a hypoxic tent. So they will sleep at a high altitude. So those 8 hours where you don't have as much oxygen, your body's still learning to use oxygen better and increase more red blood cells. So you're still getting the benefits of being 2,000 meters above sea level, but then you train low, which means you train in an oxygen-rich environment. So you get a more quality session. You'll also recover better. So you get the best of both worlds. So you train high, and you live high, and you train low.